What's up, guys? Today we're going to be talking about the os coxae. It's one part of the hip. There's two os coxae that form up the hip bone or innominate bone. It's a very unique bone, and it's built up of three separate parts, which we'll go into in just a sec. All right. So the three parts of the os coxae is the ilium, the ischium, and the pubis. I set up some different landmarks so you get an idea of where we're at in the body, but knowing that it's three separate bones, it all fuses into that os coxae is very important. And you need to know your orientation. The orientation is key. So if you find your acetabulum, that is where the femoral head sits in, and that is more lateral. Then you find the pubis, which points out anteriorly towards the front of the body. And then you look for your ischium, which is more towards the back of the body. So that's our orientation. It gets us set up. Once you find these, you could find our ilium, which is superior. All right. So once again, you have our ilium superior, your pubis, which is anterior, inferior, and our ischium, which is posterior and inferior. We have our pubic symphysis. This is where our other os coxae joins up. All right. So once you have your orientation down, you can very easily distinguish these landmarks. So we have our anterior superior iliac spine, then our anterior inferior iliac spine, and it's the nameless notch in between them, so it doesn't have a name. Then we have our iliac crest. It's the superior border of our ilium. And then you have your ala or iliac fossa. Ala is butterfly wing. You have our iliac tuberosity and our auricular surface. Our auricular surface interacts with the sacrum, maybe forming the sacroiliac joint. You have our posterior superior iliac spine, and then our posterior inferior iliac spine just inferior to that. Our greater sciatic notch, it's a notch because it's not closed off yet, becomes closed off by our sacrospinous ligament. We have our lesser sciatic foramen or lesser sciatic notch. It's a foramen when it's closed off by our sacrotuberous ligament. Then we have our ischial tuberosity. It's what we sit on. It's more on the posterior side. We have our obturator foramen, which is another foramen or hole in the os coxae. And it has also our obturator canal, which has all our nerve vasculature that goes through it. We have a ramus of ischium and our inferior pubic ramus. You have our pubic tubercle, and then the pubic symphysis. Once again, that's where the other os coxae connects. Our acetabulum and our lunate surface, where our femoral head sits in. With our acetabular notch, it becomes a foramen with a transverse acetabular ligament. Then we have our ischial tuberosity, which is where we sit on. And so we're already kind of did the full circle. So now we're facing more on the posterior side. All right, so we have three separate lines. We have our anterior, posterior, and inferior gluteal line. You'll notice that the inferior gluteal line is more anterior than the anterior line. So it's anterior, posterior, which are both superior to that inferior gluteal line. We have our arcuate and pectineal line. The arcuate and pectineal line make up the iliopectineal line, which separates the true from the false pelvis. That's very important, and I have information above about what's distinguishing those two. So the hip is very important to know anatomically. You're going to be able to have to diagnose and treat patients that are hurting from the hip. So knowing that important landmarks is our first step for it, okay? Good job. Thank you, guys.